Hey folks, if you've watched the last 4 videos, my name is Rob, and I talked about Medicare's Part A, B, C, and Medicare supplement plans. Now I'm talking about Part D. Part D is what is known as your prescription drug coverage, folks, and that's an important thing. A lot of people don't realize that when you're first eligible for Medicare, you have to enroll in a Part D plan, and I cannot emphasize that enough. If you don't roll in a compatible Part D plan, whether it's an individual Part D or something through Part C, you can face a penalty. And typically it's 1% of the national average each month that you would have delayed Part D enrollment. And I'll tell you what, doesn't sound like a lot, folks, but I've had clients that have delayed 4 and 5 years, didn't know that they were supposed to enroll in a Part D plan, and guess what? They got hit with a pretty big penalty. So you're going to have to check your individual states as well as check with your individual agents as to what that penalty may incline. Bottom line, you want to make sure that you enroll in a Part D plan when you're first eligible, because again, even if you're not on prescription drugs now, you never know what may happen in the future. And again, Part D typically covers your generic drugs, your preferred generic drugs, your brand name drugs, your specialty drugs. And again, you can enroll in 2 flavors, either an individual plan or through a Part C plan. And if you decide that you're going to enroll in an individual plan, you can enroll with Parts A and B and an individual drug plan alone, or you can enroll in Parts A, B, a Medicare supplement plan, and a Part D plan, or you can enroll in a Part C plan only. You can't have an individual drug plan combined with the Medicare Advantage plan, at least not for now. You can't do that. So you either got to do one or the other. But as I mentioned in Part C, typically there's 5 tiers that these drug plans cover. And like I said, typically they cover your generics, your preferred brands, your specialty drugs, that type of thing. Typically each plan has 5 tiers. And again, some plans have right around a $315 deductible before they kick in. Other plans have no deductible. Some plans, the generics are like $2 or $3 or $4. Some brand name plans have, a $4 or $5 or $10 or $15 or even a $45 coverage, per copay per drug for a 30-day supply. They also have really good deals if you do a 90-day supply. So that may be the way to go. Also, as I mentioned in Part C, you want to try to avoid that dreaded donut hole, or what's called the coverage gap. And I'm actually going to read that to you right now. And this is right off of Medicare.gov. So it says here, most Medicare prescription drug plans have a coverage gap, also called the donut hole. This means there is a temporary limit on what the drug plan will cover for drugs. Not everyone will enter the coverage gap. Coverage gap begins after you and your drug plan have spent a certain amount for covered drugs. In 2014, once you and your plan have spent $28.50 on covered drugs, the combined amount plus your deductible, you're in the coverage gap. This amount may change each year. For 2015, you're in the coverage gap once you and your plan have spent $29.60 on covered drugs. Also, people with Medicare who get extra help paying Part D costs won't enter the coverage gap. I won't get into that, folks. Some people do qualify for something called the Medicare Savings Program. That's a separate thing. If you want to know about it for Connecticut or any other state, you can contact me. Once you reach the coverage gap in 2014, you'll pay 47.5% of the plan's cost for covered brand name prescription drugs. You'll pay 45% in 2015. And if you recall, folks, I talked about this in Part C of Medicare. If you didn't see it, certainly rewatch the video. Anyway, although you'll only pay 47.5% of the price for the brand name drug in 2014, 97.5% of the price, what you may pay plus the 50% manufacturer discount payment will count as out-of-pocket costs, which will help get you out of the coverage gap. What the drug plan pays toward the drug cost, toward the dispensing fee, isn't covered towards your out-of-pocket spending. Example, Mrs. Anderson reaches the coverage gap in her Medicare drug plan. She goes to her pharmacy to fill a prescription for a covered brand name drug. The price for the drug is $60, and there's a $2 dispensing fee that gets added to the cost. Mrs. Anderson will pay 47.5% of the plan's cost for the drug. 60 times 47.5 equals $28.50 plus 47.5% of the cost of the dispensing fee. 2 times 475 equals 0.95, or a total of $29.45 for her prescription. 59.45 will be counted as out-of-pocket spending and will help Mrs. Anderson get out of the coverage gap, because the amount that Mrs. Anderson pays, $29.45, plus the manufacturer discount payment, $30, count as out-of-pocket spending. The remaining $255, which is 2.5% of the drug cost, and 2.5% of the dispensing fee paid by the drug plan, isn't counted towards Mrs. Anderson's out-of-pocket spending. What does that mean, folks? Basically, the government is helping to supplement both her generics and her brand name drugs, which will help her to get out of the donut hole quicker and faster than if a couple of years ago there was no help. So that person had to pay all costs, which was pretty tough. Recently, they've made some changes so that will help her to get out of the donut hole quicker and faster. So anyway, with that said, once she has come out of the donut hole on the other side, she's going to have lower copays for both her generic and her brand name drugs. So with that said, I'm going to place a description of that below, because I don't want to make this video longer than it has to be. Long story short, donut hole, you want to avoid it by trying to stay within your generic drugs versus doing brand names. Like I said in Part C, if you can't avoid brand names, you want to get into generic. So long story short, folks, Part D, you can get it either through a private insurance company, Part D, or you can get it through Part C, again, private insurance company, and you can get it coupled with either your Medicare supplement plan, or you can get it through a Medicare Part C Advantage plan. So with that said, folks, this concludes Part D of Medicare. Hopefully you understand it. If you don't, always give me a call, and I will help you walk you through the confusing world of Part D. Thanks so much, and we'll talk to you soon.